history had improved. However, something else was discovered, which is that between scan 2 and 3, the child was in daycare, and there was an abuse situation or abusive type situation of the daycare provider, and the child had changed schools. So that's very interesting that you can see that change in their environment, and that's a behavior change show up in the behavior of their nerve system as the child was getting healthier, and probably as the family was getting healthier, so they could perceive and make that change. Now let's talk about thermography. Thermal scan over here is measuring a different part of the nerve system. While that was looking at the motor nerve system, this area is looking at the autonomic nerve system, glands, organs, body chemistry, and its impact. Now, when we look at these over here, white is that normative data range, green is abnormal, blue is very high, and red is severe. Now, if I look at this initial scan 1 and 2, it is a very similar thermography pattern, especially around the mid-thoracic regions. In fact, thermal scan number 2 would be a worse intensity and the same pattern. Now, if I go to thermal scan number 3, it even looks like it's getting more intense. You're seeing this upper cervical C1, 2, 3 fluctuation that's the same right and left. And you're also seeing in the mid-thoracic area that same pattern. Now, if you go to thermal scan 4, there's a change in pattern upper cervically. However, there's not a change in the pattern around those mid-thoracic areas. That continues to be an excessive heat pattern. Now, what we did find out is at this point is after scan 3, this patient had consulted with an MD, and they found out that at that point she had not known that she had digestive cancer, a type of digestive system cancer. So I want you to realize that when you have a consistent thermal pattern, which is showing a consistent neurological behavior, in this case heating the skin, in the same way months and months apart, that is a sign of either pathology existing or a pathological state that's going to be developing because the nerve system is patterned. And this is in pattern, which is consistent with the work that BJ Palmer did with thermography in the Palmer Clinic. The interesting thing is that scan number 4, the person did have surgery. So interestingly enough, at that point, they have surgery. So when you see a consistent pattern with a person, you have to take it very serious because it means their nerve system is not changing. Now, on this slide, what we're looking at is a static EMG reading. And now this person presented he was emaciated, he was pale, he was gray, he had serious pain, he could not lie on the table to be worked on. We had to work on him standing up. And before he had come in to see us, he had been diagnosed with prostate cancer, and that prostate cancer metastasized throughout his body. So that's his state where he came in at that first picture. So that's the state of his nerve system and how his nerve system is handling life and the world. Now, if you look at static EMG number 2, which is the bottom 2 pictures, what do you see? If you look along the left side, intensity is significantly decreased. So there's a change in intensity. However, if you look at the patterns on the right, which is the asymmetry patterns, actually intensity is increased. However, if you look closely, even though the readings are more intense, there's a change in behavior. Whereas in the upper right pictures, C1 is working overtime on the right, and from there on, C3 down, the majority of the readings are on the left. If you go to the lower right SEMG2 picture, the C1 is a completely different position, so that's organized differently, and from C3 down is not all on the left. You see left, right, so there's an organizational pattern change. I would consider that the person's behavior is changing in a very positive way, even though there's more intensity, and sometimes when behavior changes, things things can look out of control. So there's a decreased level of activity, but there's a high level asymmetry, more counterbalance, which is a very great change. So that represents a behavior change. Now, if you look at this particular picture, static EMG 1 and 3, this is the same patient. The top one is that initial scan of the person that presented emaciated, pale. He had been diagnosed with prostate cancer. And this is his third picture. So look at the intensity continue to change, and also look at the in the reorganization that has happened. Those readings are almost all within a normative data range for asymmetry in that lower right, and they're almost all completely alternating left to right. This is a profound neurological behavior change. You want to see the person's nerve system behaving like this level of integrity and better, and continue to do that so they can have good nerve supply to heal what has transpired from most likely, or what is likely years and years of a loss of spinal and neural integrity. Now let's look at structure. So instrumentation tends to reflect behavior patterns, neurological behavior, muscular behavior patterns. When we're looking at x-rays, we're looking at what the static structure is doing. Now, if you look at the images on the left, these are pre-x-rays. I want you to notice the midline blue line, and that blue line is going from the sacrum straight up, perpendicular to the ground, and then the dotted red line goes between the segments of the person. Now, if you look at the picture on the right, that's the post x-ray. This is 12 months later, and obviously you notice in both films that the person has quite a bit of hardware placed in there. So he had prior surgery before he had come to see us, and even with the surgery, the gentleman had severe levels of pain. He could not walk. He had lost function and lost ability to control being able to go to the bathroom, and this was even after surgery. So he came to see us to see if he can have improvements. He was able to regain walking, take up his golf game again, and also some urinary control improve. So this is an amazing change, and you can see that the structure is literally changes. It's not as shifted laterally to the left. And remember, on these films, you're looking at them from behind, so your left is their left, their right is your right is their right. But what we would like to see more and more is their head completely over their sacrum. That's an ideal that we want to see. Now, this is a structure change. I will say on this particular person, his scans had a very similar behavior, and his perception relationship in his body, other than symptomatic change, had not really grown. So you can talk to a person about their progress. Hey, these x-rays look great. Your structure is improving. We need to see improvement in your perception relationship to your body, as well as with your behavior patterns, because otherwise these behavior patterns of your, the structure of your x-ray is going to return quite quickly if this behavior doesn't change. Now let's look at that in the next slide. Now, if we look